I'll be involved in the international discussion group on the management of CLL in Nigeria and other restricted resource settings. And we'll be talking about the inequity in research. And we have observed that funding is a major limiting factor for research in our part of the world. And before you can actually make a move to interacting with government in terms of advocacy for our patients, you need data. We need to have collected sufficient data to show evidence that indeed there is lack in the system at various levels. So we are short of research to provide us the data we need to do advocacy efficiently and effectively. Whereas in the high resource settings, you have robust molecular diagnostic tools for CLL, which we don't have. We have a limited diagnostic tools, and we have only just set up the FISH protocol for diagnosing malignant conditions in our center at OAU-THC Ileife, Nigeria. And so it's more or less in the early stages. So we have preliminary data, which is not robust enough, and we need to build on that to acquire sufficient data to be able to advocate effectively for our patients, to empower our patients to be able to have more confidence in what we do for them, and also to help them to sign the informed, give consent to participating in clinical trials, which is the bottom line, really. For high resource settings, there's a lot of clinical trials going on. And whereas in our country, the restricted resource setting, like Nigeria, we've not had any clinical trials for cancer, like CLL. There are clinical trials going on for breast cancer and other more common cancers, but not for the rarer cancers like CLL. So we really need to encourage our patients through whatever limited data we have to convince them that indeed it's worth, participating in clinical trials. And that will also help to empower them to be able to know more about their disease and know how to take care of themselves and the type of medications they're supposed to take, type of reactions and responses they should have, and how to manage them, and also to help the family. The patient is not alone. He's in a family setting, and members of the family are also carried along. And that is why the patient support group is very, very important. And we only have one patient support group that is registered with a plan, that is the CLL Advocacy Network, led by Nick York. And I met Nick in 2019, or actually in 2017, in Liverpool at the BSH. And that's when he encouraged me to come back to Nigeria and set up a patient support group for CLL, and we've been doing that since. But COVID got in the way. There was interruptions in between, but we are back on track. And for the World CLL Day for September 1, we were able to meet on the 5th of September, at least the few patients that were around to meet on that day. I was able to give them some information that we have concerning the study of CLL so far in Nigeria, and the role that IWCLL is playing to try and equip us and capacity build us to doing more in terms of diagnosis of CLL, and also to characterize CLL to the molecular level, in addition to the FISH tool that we have set up, we will need to get involved with molecular sequencing methods so that we can get the actual data on the IGHV mutations that we may have in our patients, which we don't have any information about. And as for the TP53, we're using FISH to do that. But that again is limited because the molecular mutations, that is the mutations that are beyond the deletions, we can't do FISH we can't use FISH for that, but we'll need molecular testing kits for that. So we have obtained a grant from IWCLL that will help us to characterize CLL better in the south west of Nigeria. And 10 centers will be collaborating with us at OAUTHC Leife to ensure that we're able to get adequate data in order to provide answers, at least some answers, to the needed questions concerning the diagnostics and possible prognostic features of CLL in our environment. So funding is a major limitation. And that is why we need to advocate for our patients more. And with data coming out of the studies we're doing, we should be able to do this better. Come 2-3 years' time when we are done with this study, we have limited data right now, which, as I said, is not adequate. This was a study we did previously that was supported by TED Fund at the federal level in Nigeria. So the IWCLL capacity building grant that we got is a stepping stone forward to establishing the database for CLL in this part of Nigeria. And hopefully we will be able to expand this to other parts of Nigeria in the near future after we have concluded this particular study. But by and large, it's important to stress that our patients don't have health insurance that helps them to navigate their disease and manage themselves well. So most of what they have to do is out of pocket. And so it's a limitation, and that's probably why our patients don't live so long. And so getting on clinical trials, you need to have patients who are alive, who can come up and sign up to be part of clinical trials. So we also hope to develop a database, a disease-specific registry for CLL in the process of conducting this study.